So it's time now for the second part of our in-depth interview with the APA President, Dr. Jeffrey Lieberman. I'm delighted to be back with Dr. Lieberman now. Dr. Lieberman, thanks again for joining us.
Sure, my pleasure.
Now let's talk a little bit about your work. I know that you've got a book coming out soon, so tell us about how did that come about?
I began my career pursuing psychiatric research in the area of schizophrenia, specifically in the neurobiology and psychopharmacology. And it's only when I sort of began to see, as a researcher and as somebody who was treating people with mental illness, how our progress in advancing treatment and being able to provide it in the way that we knew would be helpful was limited by our government policies and particularly government funding. On one hand, the insurance coverage, whether it's private or public, does not provide adequate coverage for mental health services. And on the other hand, in terms of research, which we now can really apply very forcefully to understanding the brain and how it underlies mental illness, how the very limited amount of funding that is given for mental illness research was really impeding progress, that I began to think, you know, I need to do more than just spending time in a lab trying to understand how the brain can go wrong and cause disturbances in mental function. And so one thing I did was decide to get active politically, and I ran for president of the APA and have been in that role for the past year. But in addition, I appreciated that it may be needed to try and communicate directly with the public through the media in a way that could broaden awareness and send a message about how we're trying to fight this battle with one arm tied behind our back. So I began talking to some colleagues of mine who have written before, like Kay Jamison, who wrote a series of brilliant books, including An Unquiet Mind, Andrew Solomon, who wrote Far From the Tree and Noonday Demon, and they encouraged me to write a book. And so I'm in the latter stages of finishing it. It has kind of a, I'm not so sure, laudatory title, but my publisher says it's a good title. It's called Shrinks, The Untold Story of Psychiatry. And it basically talks about contemporary psychiatry, what its capabilities are, how it should be understood by people, and then reviews kind of the history of how psychiatry evolved as a discipline and got to where we are.
It's really important, isn't it? Because conferences like this are great, bringing folks together in the field, but it's so important to actually reach out and communicate directly with the public, isn't it?
I think more about psychiatry. I mean, I think it's true for all of healthcare and medicine. And now, the adage that an educated consumer is the best customer. In medicine, the educated patient who participates is the best patient. Right. But it's more so for psychiatry because people don't really appreciate what mental illness is. They don't know if they do see a need for them or a family member, sort of who to go to, how to judge a good doctor or a less good doctor. And also there's a lot of ambivalence about the value of psychiatry. Are these basically people that know what they're doing? Is there a real scientific basis for it? How do you know if there's really something wrong with you or you're just basically having usual problems in living? And do any of these treatments work? So where do people go for information? They can ask their GP, and their GP may know, but our colleagues in other areas of medicine aren't necessarily that knowledgeable about the current state of psychiatry and don't necessarily take the time to try and sort of communicate about that aspect of their patients' needs. So I figured if I have any kind of credibility as the chair of psychiatry at Columbia, as the president of the American Psychiatric Association, maybe that'll give me the bully pulpit to provide this information to people.
Well, Dr. Lieberman, thank you very much indeed for sharing that with us today, and we look forward to the book coming out, so thank you.
Thank you, Steve.